Hello everybody, I'm Tara Landry with Laerdal Medical. Thank you for joining us today at IMSH. I'm here to give you a little tour of our booth and some exciting things that have been going on over the past couple of days. We're going to start off at our OB solution, Mama Ann. Mama Ann is our birthing simulator, and she's designed for modularity, for training in OB deliveries, also to address any obstetric emergencies and be prepared and trained for those. She is modular, as I had mentioned, so you have the ability to go from delivery to a postpartum hemorrhage during your training. She also has the ability to deliver multiple deliveries, difficult delivery, breech birth, shoulder dystocia, and she's very easy to use and set up. As you can see, she has her plate that kind of covers up the baby for the delivery, so the setup is very seamless and very easy to use. Next station here, we're focusing on mixed reality. So what's really exciting about this is a device where you use like this task trainer product, and it shows your hand activity. So you have to use some communication through artificial intelligence and mixed reality to actually utilize this product so learners can kind of see their psychomotor skills as they're going through the training and the processes here. Here we have Jasper. He's kind of demonstrating the headset and the device here that the students would use in conjunction for the training in this mixed reality solution. So here's our neonate station where we have two of our neonatal simulators. We have Emily, who is our newborn, so she's designed for NRP up to birth, so she's an NRP designated trainer. She's got multiple skills for advanced care of a newborn. On the other side, we have Paul, who is our 27-week preemie. So he's designed for stabilization and premature care for early stages of delivery for a premature infant. So this is SimMan Critical Care. So he is our new respiratory simulator. So he is based on the 3G Plus platform. As you can see here, he does work with a ventilator. He's fully intubated and the ventilator is breathing for him. He's used in multiple respiratory situations, from ARDS to asthma to difficult breathing. He also has the ability to wean himself, so he's the closest thing to a human lung as a simulator can provide. So he's got a multitude of use specifically in critical care. You could use him anywhere from the emergency department all the way up to the ICU for your training needs. So this is our Sim Capture station. This is our center management solution. So this is everything from operationalizing to your curriculum development of your center. Sim Capture here does everything from assessment, management, and also does some debriefing. It's really your pathway to competency-based education. So this is a guide that folks can use in their simulation training to enhance learning for the students, where they can really focus on skills and data. It's really important to make sure that we're capturing that, because that really drives the learning in the simulation environment. So this is our emergency live immersive experience. The tool in this experience is the SimMan Critical Care. What we're doing is showcasing the multiple ways that you can use simulation in your training. We are having a SimMan Critical Care in here as part of the training, but we're also talking about ways in which Laerdal can help you implement your simulations. We do have a program called Accelerate, where you can actually utilize Laerdal resources to help with data, to help with tracking, and to help run simulations. So we're showing kind of an emergency department here where there's a motor vehicle accident, and letting participants see kind of how you can integrate the SimMan Critical Care and some of the Laerdal resources into that training. If you'd like to take a quick look inside, you can see the ED setup in here, and we have attendees, participants coming through and participating in the experience and seeing firsthand action of the SimMan Critical Care. So this is our virtual clinical experience with VR Clinicals. VR Clinicals is designed for multiple patient use with students, where they can manage up to 4 patients at a time, learning how to prioritize and assess different patient populations within a shift that a nurse would have in a clinical setting. We're showing you here some activities that we're doing. All the activity is happening through the headset, but you're doing those psychomotor skills by utilizing the equipment in the space. The learners have to go through where to place things, how to place things. They also have going to be able to have a communication component for conversational AI, where the student can actually speak to the patient will speak back and have a full communication back and forth, which is going to be very critical for communication learning in the clinical environment. This is our Laerdal Global Health section. So outside of everything we do locally here in the United States, we do have a presence in the world, in the global world, to really focus on helping lesser nations that need some assistance with birthing, from Mama Berthy, Mama Natalie. These products are really, what's really neat about it is if you purchase a Mama Ann, you can actually donate. A Mama Berthy gets donated to a location in one of the deprived nations that we do a lot of work with to try to increase and awareness for helping babies breathe and making sure the deliveries are happening in a very safe environment. And our goal is tying into our mission of helping save lives, and our focus is on saving a million lives as we go through this and try to dedicate some resources outside of the U.S. here. I hope you enjoyed our tour of the Laerdal booth. Thanks for stopping by.